good morning. Today I want to talk about something extremely important that often goes unnoticed, especially by those over the age of 60. Stroke is a serious medical condition that can lead to severe disability or even be life-threatening, and it is well known that the risk of stroke increases as we get older. However, what is less commonly understood is how certain everyday habits, particularly those we perform each morning, can significantly impact that risk. Recent research has highlighted one specific morning mistake that, if left uncorrected, may actually triple the likelihood of experiencing a stroke later in life. Our bodies and brains change as we age, and the health of our blood vessels becomes even more critical. The arteries that supply blood to the brain can become less flexible and more prone to damage, and the way our blood flows and clots can also be affected. This particular morning behavior disrupts the delicate balance necessary for optimal blood circulation and vascular health. When this balance is disturbed, it creates an environment where clots are more likely to form, or where blood pressure can spike dangerously, increasing the risk of a stroke. This is not just speculation. It is backed by strong scientific evidence from multiple studies conducted over recent years. These studies have examined large populations of people over 60, tracking their health habits and stroke outcomes. What they found is that those who engage in this specific morning mistake are at a significantly higher risk compared to those who avoid it. Understanding the physiological reasons behind this is essential. The mistake can cause fluctuations in blood pressure or affect the body's natural rhythms, placing extra stress on the brain's blood vessels at a time when they are most vulnerable. But the good news is that this risk is something you can actively reduce. Making simple adjustments to your morning routine can have a profound effect on your stroke risk. It could be as straightforward as changing the timing of certain medications, modifying hydration habits, or even adjusting meal patterns early in the day. These small changes support healthier blood flow and help maintain stable blood pressure levels, reducing strain on the brain's vascular system. It is also important to remember that managing your overall health remains paramount. Regular monitoring of your blood pressure and other vital signs, maintaining a balanced diet, staying physically active, and managing chronic conditions like diabetes or high cholesterol all contribute to lowering your stroke risk. And importantly, always maintain open communication with your healthcare provider. Regular check-ups provide an opportunity to discuss your habits and make evidence-based changes tailored to your individual health needs. Preventing a stroke requires vigilance and a willingness to make informed decisions about your health, especially as you grow older. The choices you make every morning can either increase or decrease your risk, and understanding this empowers you to take control of your brain health. I encourage you to be proactive, stay informed, and remember that prevention is far better than treatment when it comes to protecting your brain and quality of life. Thank you for your attention today. I hope this information helps you make safer choices that support a healthier, longer life. Stroke is a medical emergency that occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. Within minutes, brain cells begin to die. This can lead to permanent brain damage, long-term disability, or even death. Stroke is one of the leading causes of death and disability worldwide, and the risk of experiencing a stroke increases significantly with age, especially after the age of 60. This makes understanding the risk factors and early warning signs not just important, but potentially life-saving. As we age, the body naturally undergoes changes that can elevate stroke risk. Blood vessels lose elasticity, making them more prone to narrowing or damage. The heart may not pump as efficiently, and conditions like high blood pressure, diabetes, high cholesterol, and atrial fibrillation become more common, all of which are major contributors to stroke. Many people over 60 also take medications that can influence blood pressure, hydration levels, and blood clotting. While these medications are often essential, they must be carefully managed to ensure they are not increasing stroke risk inadvertently. It's also important to understand the difference between the two main types of stroke: ischemic strokes, which account for about 87% of all strokes, happen when a blood clot blocks or narrows a blood vessel leading to the brain. Hemorrhagic strokes occur when a blood vessel in the brain bursts, leading to bleeding in or around the brain. Both types are serious and require immediate medical attention. Risk factors such as uncontrolled hypertension, smoking, excessive alcohol consumption, and sedentary lifestyle can contribute to both forms. But even things that seem minor, like skipping water in the morning, standing up too quickly, or delaying medication, can act as triggers in a vulnerable body. What makes stroke particularly dangerous is that it often strikes without warning. The symptoms, sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, difficulty seeing in one or both eyes, trouble walking, dizziness, or loss of balance, can appear quickly and escalate rapidly. This is why public health messages often emphasize the acronym FAST: face drooping, arm weakness, speech difficulty, time to call emergency services. Recognizing these symptoms early and responding immediately can be the difference between a full recovery and a life-altering outcome. The good news is that stroke risk can often be reduced through simple but consistent lifestyle changes. Staying physically active, eating a balanced diet low in sodium and unhealthy fats, avoiding tobacco, and limiting alcohol are all well-established ways to protect brain and heart health. Regular checkups with a healthcare provider allow for early detection and treatment of risk factors before they lead to more serious issues. Importantly, paying attention to how we start our day, our hydration, our medications, our movement, can also play a powerful role in maintaining brain health. In summary, while stroke is a serious and potentially devastating condition, it is often preventable. The first step is understanding the risks and being mindful of the daily habits that may be increasing those risks without us even realizing it. Empowering yourself with knowledge and making thoughtful choices every day, especially in the morning, can go a long way in protecting your brain as you age. There are several common morning habits that many people carry out without a second thought. Yet some of these can have a surprising impact on stroke risk, especially in individuals over the age of 60. Our bodies go through natural shifts overnight, including changes in blood pressure, hydration levels, and circulation patterns. The early morning hours are already a time when the body is under more stress. In fact, studies have shown that the risk of stroke is higher in the morning than at other times of the day, largely due to a combination of physiological changes that occur as we transition from sleep to wakefulness. When certain habits are added to this vulnerable period, they can amplify the risk even further. One of the most overlooked but important factors is dehydration. Many people skip drinking water in the morning or go straight to caffeinated beverages like coffee or tea. While these drinks aren't inherently harmful in moderation, they can act as diuretics and may worsen dehydration. After several hours of sleep with no fluid intake, the body wakes up naturally more dehydrated. Blood becomes thicker and flows less easily when hydration is low, which increases the likelihood of clot formation. A major risk factor for ischemic stroke. Simply drinking a glass or two of water shortly after waking can help reduce this risk significantly. Another common mistake is getting out of bed too quickly. When a person stands up suddenly after lying down for several hours, blood pressure can drop sharply in some individuals, especially older adults. This sudden drop, known as orthostatic hypotension, can reduce blood flow to the brain momentarily and, in some cases, contribute to dizziness, falls, or even trigger more serious vascular events if underlying issues like arterial stiffness or high blood pressure are already present. Skipping breakfast is another habit that may increase stroke risk. A healthy morning meal helps stabilize blood sugar levels and supports metabolic balance throughout the day. Long periods of fasting, especially for people on medications for blood pressure or diabetes, can lead to sudden spikes or drops in blood pressure and blood sugar, creating added strain on the cardiovascular system. Moreover, consistently missing breakfast has been associated with a higher incidence of conditions like hypertension and obesity, both of which are linked to increased stroke risk. Some people also make the mistake of delaying their morning medications, particularly blood pressure medicines, which are often prescribed to be taken early in the day, postponing them, either due to forgetfulness or changes in routine, can lead to uncontrolled blood pressure during the morning hours when it is naturally at its highest. Maintaining a regular schedule for medications is key to keeping stroke risk in check. In addition, many people start their mornings with high levels of stress or mental overload, immediately checking emails, social media, or news that might trigger anxiety or negative emotions. Chronic stress and poor mental well-being are known contributors to cardiovascular problems. Cortisol levels are naturally higher in the morning, and added stress can further increase blood pressure and heart rate, putting unnecessary strain on the arteries. These habits might seem minor in isolation, but when combined with age, related changes in vascular health and other risk factors, they can significantly contribute to stroke risk. Making mindful changes like drinking water first thing in the morning, rising slowly from bed, eating a light, nutritious breakfast, and sticking to a consistent medication routine can make a meaningful difference. It's a reminder that sometimes the smallest changes in our daily routine can have the greatest impact on our long-term health. The human brain relies on a constant, uninterrupted supply of oxygen-rich blood to function properly. When that supply is compromised, even briefly, the consequences can be severe. One of the most common and dangerous ways this happens is through a stroke, and surprisingly, certain simple mistakes made in the early morning can dramatically increase the likelihood of such an event. This is especially true for individuals over the age of 60, when the body's natural resilience begins to decline and the cardiovascular system becomes more vulnerable. Understanding how one particular morning mistake can affect the brain and blood vessels requires a closer look at what happens internally during those first few hours after waking. During sleep, the body enters a resting state. Heart rate slows, blood pressure drops, and hydration levels gradually decrease as we lose fluids through breathing and minimal sweat. When we wake up, there's a sudden shift. The body starts preparing for activity. Heart rate increases, blood pressure begins to rise, and blood starts moving more quickly through the arteries. This natural surge in the cardiovascular system puts temporary pressure on the brain's blood vessels. If you then add a mistake, such as skipping hydration, delaying essential medications, standing up too quickly, or skipping breakfast, the pressure on the system can become too much. When someone skips water in the morning, the blood becomes slightly more viscous or thicker. This makes it harder for the heart to pump and for the blood to move smoothly through the brain's narrow vessels. In a healthy young person, this might not cause any symptoms, but in someone over 60, especially someone with pre-existing conditions like high blood pressure or atherosclerosis, this increased viscosity can elevate the risk of clot formation. If a clot forms and travels to the brain, it can block a vessel, causing an ischemic stroke. Similarly, when a person stands up too fast from a lying position, the sudden change in posture can cause a rapid drop in blood pressure, leading to dizziness or fainting. In older adults, this can also reduce blood flow to the brain, potentially triggering a cascade of vascular stress that might lead to vessel rupture or blockage, especially if the arterial walls are already weakened. Over time, repeated stress like this, particularly first thing in the morning, can cause the blood vessels in the brain to become less flexible and more prone to damage. Furthermore, delaying medications that control blood pressure or heart rhythm can result in the body going several critical hours without needed regulation. Morning is a time when blood pressure tends to spike naturally, a phenomenon known as the morning surge. Without medication to blunt this rise, the blood pressure can soar to dangerous levels. In individuals with compromised vascular integrity, such spikes can rupture small arteries in the brain or dislodge plaques from vessel walls, either of which can result in a stroke. The mistake might seem small or harmless. A missed glass of water, a skipped pill, a rushed start to the day. But the underlying effects on the body are real and measurable. These actions influence how blood moves, how pressure builds in the arteries, and how well the brain is protected during a vulnerable period. And when repeated over days, weeks, or years, the cumulative stress on the brain's vascular system can significantly raise the chances of a stroke occurring. Being mindful about how we start our mornings, especially after the age of 60, isn't just about feeling better during the day. It's about protecting our long-term brain health. Small, consistent changes, such as drinking water upon waking, taking prescribed medications on time, rising slowly, and avoiding excessive stress, can help ensure the brain receives the steady, balanced blood flow it needs to stay healthy and sharp. These are simple habits, but they act as powerful tools in reducing preventable damage to the brain's delicate vascular network. Over the past few decades, scientific research has provided valuable insight into the connection between morning routines and the increased risk of stroke, especially among older adults. A number of peer-reviewed studies and clinical observations have revealed that the early hours of the day, particularly within the first few hours of waking, represent a high-risk window for cardiovascular events, including stroke. This vulnerability is tied to natural physiological changes in the body and how certain habits can either support or strain the body during this critical period. One of the most consistently reported findings is the concept of the morning surge in blood pressure. Research published in journals such as Hypertension and the Journal of the American College of Cardiology has shown that blood pressure tends to rise sharply in the first few hours after waking. This spike can place added stress on arteries, particularly in individuals who already have stiffened or narrowed blood vessels due to age or chronic conditions. A Japanese study involving over 500 participants found that those with an exaggerated morning blood pressure surge were significantly more likely to experience a stroke, especially if they were over the age of 60. This has led many physicians to recommend that patients with hypertension take their medication early in the morning to counteract this surge. Dehydration has also been studied as a contributing factor. When the body is dehydrated, blood volume decreases and blood becomes more viscous. This means it flows less easily, increasing the chances of clot formation, especially in smaller cerebral arteries. A study in stroke, a journal published by the American Heart Association, noted that lower hydration levels were associated with worse outcomes in stroke patients and suggested that even mild dehydration could impair cerebral perfusion, making stroke more likely in at-risk populations. Skipping breakfast has similarly come under scientific scrutiny. A large-scale cohort study from Japan, involving more than 80,000 individuals, found that people who regularly skipped breakfast had a significantly higher incidence of stroke, particularly cerebral hemorrhage. Researchers believe this is due in part to metabolic stress placed on the body when it's forced to go extended periods without nutrients, especially in the morning when the body is transitioning from a fasting state. Additionally, researchers have explored how sudden changes in posture, such as standing up quickly upon waking, can contribute to transient drops in blood pressure and even fainting, a condition known as orthostatic hypotension. Studies have shown that this condition is more prevalent in older adults and has been linked to a higher risk of stroke and cognitive decline. Though the effect may only last seconds or minutes, repeated episodes can create conditions that stress the vascular system over time. Moreover, evidence from wearable health monitoring devices has added a new layer of understanding. These devices, which track metrics like heart rate variability, blood pressure, and activity patterns, have shown that many stroke events cluster in the morning hours. This data supports the idea that both internal biological processes and external behaviors play a role in this timing pattern. Together, this body of scientific evidence underscores the importance of a stable and mindful morning routine. While more research continues to emerge, what we already know makes it clear. Avoiding certain morning mistakes, like skipping hydration, delaying medication, and neglecting proper posture or nutrition, can help lower stroke risk. Science continues to reinforce the idea that prevention begins not only in the doctor's office, but in how we care for ourselves during the very first moments of each day. Reducing the risk of stroke doesn't always require dramatic lifestyle overhauls. In fact, many of the most effective changes are small, simple adjustments that can easily be incorporated into a daily morning routine, especially for those over the age of 60, when the body becomes more sensitive to fluctuations in blood pressure, hydration, and stress. By being more intentional with how we begin the day, we can support healthier blood flow, improve brain function, and reduce the risk of stroke in a meaningful and sustainable way. One of the easiest and most effective changes is to begin each morning by drinking a full glass of water. After 6 to 8 hours of sleep without fluid intake, the body naturally wakes up in a mild state of dehydration. Rehydrating first thing in the morning helps to thin the blood, promote circulation, and reduce the chance of clot formation, particularly in people who are already managing high blood pressure or vascular issues. Room temperature water is often ideal as it's gentle on the stomach and quickly absorbed. Another beneficial adjustment is to take a few moments to transition from sleeping to standing. Rather than jumping out of bed immediately, it's helpful to sit up slowly, allow the body a few seconds to adjust, and then gradually stand. This simple act can help prevent sudden drops in blood pressure, known as orthostatic hypotension, which are more common in older adults and can increase the risk of dizziness, falls, or reduced blood flow to the brain. For people who often feel lightheaded in the morning, keeping a bottle of water and light snack near the bedside may also help regulate blood sugar and circulation upon waking. For individuals who take medication, especially for blood pressure, cholesterol, or heart rhythm, taking these consistently and on time each morning can make a critical difference. Morning is when the body naturally experiences a rise in blood pressure, and skipping or delaying medication can allow this surge to reach dangerous levels. Setting reminders, using a weekly pill organizer, or syncing medication time with another daily habit like brushing teeth can improve consistency and lower the likelihood of missed doses. Incorporating a light, balanced breakfast into the morning routine is also important. Eating within an hour or two of waking helps stabilize blood sugar, improves energy, and supports cardiovascular function. Foods rich in whole grains, fruits, healthy fats, and lean protein can provide the body with the nutrients it needs to start the day strong. Skipping breakfast, on the other hand, has been linked in some studies to increased stroke risk and higher rates of metabolic disorders. Managing stress in the early hours of the day is another powerful preventive measure. Many people wake up and immediately reach for their phones, check emails, or consume stressful news. While it might seem harmless, this sudden influx of information can cause a spike in cortisol and blood pressure, especially if the content is emotionally charged. Taking a few quiet minutes for deep breathing, light stretching, or even a short walk can ease the transition into the day and promote a sense of calm. Starting the day on a peaceful note has been shown to support cardiovascular health and lower the risk of inflammatory responses in the body. Even maintaining a consistent sleep schedule plays a role. Poor or irregular sleep disrupts the body's internal clock, known as the circadian rhythm, which in turn can affect morning blood pressure and heart rate. Going to bed and waking up at the same time each day supports balance in the body's systems and reduces the risk of early morning cardiovascular events. These adjustments are small, but their cumulative effect over time can be significant. By giving attention to hydration, posture, nutrition, medication timing, and emotional well-being in the morning, individuals can create a safer and more supportive environment for brain and vascular health. Stroke prevention doesn't have to be complicated. It just needs to be consistent. Taking just a few mindful steps each morning can help protect the brain and body for years to come. One of the most impactful steps anyone can take to reduce stroke risk, especially after the age of 60, is to actively engage in regular health monitoring and follow professional medical advice. While lifestyle adjustments play a critical role in prevention, they become even more effective when paired with consistent medical oversight. The human body changes with age, and subtle shifts in blood pressure, heart rhythm, blood sugar levels, or cholesterol may not produce obvious symptoms at first. Left unchecked, however, these changes can significantly increase the risk of a stroke or other serious health complications. That's why early detection through regular checkups and routine screenings is so essential. Monitoring blood pressure at home is a simple yet powerful habit, High blood pressure is one of the most significant risk factors for stroke, and many people may have it without knowing. Using a digital blood pressure monitor just a few times a week can provide a clearer picture of trends and fluctuations, particularly in the morning hours when blood pressure tends to rise naturally. If the readings are consistently elevated, this gives individuals and healthcare providers valuable information to guide treatment or lifestyle changes before a crisis occurs. Similarly, regular blood sugar checks for those with diabetes or prediabetes can help prevent the vascular damage that uncontrolled glucose levels can cause over time. Another valuable tool is tracking cholesterol levels through annual blood work. High levels of LDL cholesterol can contribute to the buildup of plaque in arteries, which may eventually lead to blockages or clots that trigger a stroke. Many people assume that cholesterol issues only affect those with poor diets, but genetics and other factors can also play a major role. That's why it's important not to rely on how you feel alone. Lab tests provide information that can't be gathered by observation or intuition alone. Staying in touch with a healthcare provider also opens the door to tailored advice. Whether it's determining the right time to take blood pressure medications, assessing risk factors like atrial fibrillation or carotid artery disease, or deciding if a certain supplement or exercise routine is safe, professional guidance ensures that each decision supports overall health. Doctors can also help identify warning signs that may not seem serious at first, but could indicate an underlying issue, such as brief episodes of dizziness, changes in vision, or short-term memory lapses. In addition to doctor visits, many communities and pharmacies offer basic health screenings, making it easier than ever to stay informed about vital metrics like blood pressure, glucose, and BMI. For those who have access to wearable health devices, features like heart rate tracking, irregular heartbeat alerts, and sleep monitoring can provide further insight into cardiovascular health and daily trends that may influence stroke risk. Finally, seeking medical advice should never be viewed as a sign of weakness or worry. It's a proactive and empowering choice. Just as one would perform routine maintenance on a car to avoid breakdowns, the human body also requires ongoing care and attention. When small issues are identified early and addressed with the right treatment or adjustments, they are far less likely to escalate into serious health events. Whether it's a routine physical, a quick check-in, or a discussion about family history and risk, regular health monitoring helps create a strong foundation for lifelong well-being. It is a vital part of stroke prevention and an essential act of self-care that supports not only longevity, but also quality of life. In closing, the risk of stroke, especially after the age of 60, is not something to be taken lightly, but it is something that can be managed with awareness, intention, and consistent action. While a single morning habit might seem harmless, science has shown that the way we start our day can have a significant impact on our brain and cardiovascular health. Simple mistakes like skipping hydration, delaying medications, or rushing out of bed can quietly add to our long-term risk. But the good news is that small, thoughtful changes, drinking water first thing, moving slowly in the morning, eating a balanced breakfast, and following medical advice, can offer powerful protection. Prevention begins at home. By paying attention to the little details of your daily routine and regularly checking in on your health with the help of qualified medical professionals, you give your brain and body a better chance to age well and stay strong. Stroke is not always predictable, but it is often preventable. Each mindful choice you make today can help lower your risk tomorrow. So, take those few extra minutes in the morning, be kind to your body, and invest in habits that support your health for the long run. Your brain and your future will thank you.